My name is India Ball, and I'll be doing an IV push. I review my physician's orders, and I have an order to do a push of furosemide. When I did the calculation, it turned out to be eight mils, and I'm going to do that over 3 to 4 minutes. So the first thing I'm going to do, I know that there's an IV line in the room of normal saline going in the patient. So I'm just going to go in the make sure I'm in the med room and prepare my medicine. So I have a new thing of furosemide. I have my needle. I have this. I have this, and I would clean the top of the bottle, but I know that it's new, so I don't have to do that. I'll just check it and make sure that its expiration date is good and all that. I know I'm going to be drawing 8 mils, so I will pull back 8 mils, which actually won't be labeled beforehand. And then I'd pop the top on it, and then, let's make sure I can scoop that later, I would inject, and then I'll pull out 8 mils. Okay. And then I would use a scooping method to recap my needle. Okay. And once I have everything done, I'll take my medicine and everything into the room with my patient. I knock on the door, tell them my name. I'm India Ball. I'm your student nurse, and let them know. Get their name, 2 identifiers. John Wick, birthday 8/9/37, 1937. And let the patient know, and I make sure I wash my hands also before I touch the patient or anything like that. And then I let the patient know that the doctor ordered furosemide to get some of the fluid off of him. So I would look at the site. The first thing I would do is inspect the site, making sure that it's intact, there's no pain or anything like that. And also I would check the line and make sure that it is patent before I put anything in it. Like I said, I do know that my furosemide was compatible with what's already hanging. I'll go ahead and put my gloves on. I would take my alcohol and I will clean this port. Get ready and take my medicine. Like I said, it is compatible. Get it off. And what I would do is go ahead and clamp it. Insert my medicine. Like I said, I'm going to be giving 8 mils over 3 to 4 minutes, so I would just push a little and let go. Push a little and let go. All while watching my watch to make sure that I do it over 3 to 4 minutes. While I'm pushing, I'm just making sure that observing the site, observing my patient to make sure nothing is going wrong. And once I get all the medicine in by using the push-pause method over 3 to 4 minutes, I would pull that out, assess my patient again to make sure that everything is okay. And then I would make sure I document it, what I used, how much I used, syringe, how the patient felt, and that's it. Now that was when my medicine was compatible. Now if my medicine was not compatible, I would have 2 flushes. The first flush I would aspirate and then flush, and then put my medicine in, push-pause method, and then use the flush again. And that's on a line. Now if it was just an INT, I would do the same thing, making sure I clean it and everything, and flush it, aspirate, flush, medicine, push-pause, and then flush again, all while observing the site, observing my patient, and that's it.